Now for the news in detail. Let's begin in the U.S., where the death toll from COVID-19 has crossed 100,000 with 1.69 million infected. The virus has now killed more than 355,000 people worldwide and has infected over 5.6 million. This report has the details.
Hard-hit northeastern states in the U.S. have reported decrease in the new cases in recent days, and the pace of deaths nationwide has fallen. But cases have been rising in Arkansas, North Carolina and Wisconsin. In South America, the situation is worsening as Brazil's death toll surpassed 25,000 people. Hospitals in Peru are struggling to cope with the pandemic.
Right now, we find ourselves in a collapsed reality. We don't have beds in the ICU. We don't have beds here in the Rizola Hospital. Patients are dying every day. There are no results from authorities. So we urgently asking for results for our personal protective equipment to arrive.
Meanwhile, European countries are closely monitoring any jump in new cases following the easing of lockdown. Britain will move towards more localized actions to tackle coronavirus as opposed to nationwide measures.
We're only in a position to be able to reopen primary schools and outdoor markets if they're COVID secure this coming Monday because we've flattened the curve and now we have this system in place. And in the coming weeks, we will gradually and very carefully move away from a lockdown that's national in scope, blanket in application, and start moving towards a system that's much more targeted in scope and focuses local action on tackling local flare-ups.
Asia, South Korea is witnessing a second wave, reporting the most cases since April 5th as infections rose for a third straight day. Infections and deaths continue to pile up in India, Bangladesh, Pakistan and Afghanistan, while the pandemic appears to be slowing down in Iran.